Dr. Jamii St. Julien. I specialize in complex GI robotic surgery and surgical oncology. I practice at HCA Florida Surgical Specialists. My practice focuses on mostly upper GI things, and what that means is esophagus and stomach, liver and pancreas, small intestine, and then less so colon and rectum. When it comes to the stomach, a big part of what I do is reflux surgery, hiatal hernia repairs, but also patients who just have ongoing chronic reflux that they don't want to deal with anymore taking medicines. So I was trained in minimally invasive surgery, mostly initially in advanced laparoscopy. But over my practice, I have built a pretty big robotic practice and mostly focused now on robotic approaches. And the benefit of that is smaller incision, faster recovery. The patients can, spend much less time in the hospital. There's a lot less pain, so they need less narcotics after surgery. They can go back to work sooner. Cosmetically, it's more appealing. The incisions are smaller, less prone to infections. A lot of what I do is really no one else doing outside of academic centers. So for example, a robotic liver resection or robotic pancreatectomy. I think another thing that sets me apart is that I have very good outcomes. So I pay attention to detail. I follow my patients closely. I'm the one doing the operation. One thing I pride myself on within my practice is our ability to see patients quickly. We can usually see patients within a week, usually often within a couple of days, work them up, figure out a plan, and then communicate that with the referring provider. I like to keep those communications open, which from what I hear is something that is a struggle when trying to deal with bigger institutions. So we definitely take more of a community approach.